So first of all, I'd like to say that cancer is not one disease. Cancer is a group of medical conditions, and the important factor is that there is uncontrolled proliferation of the cells. If further proliferation increases, that turns into cancer. No cells die, but only cells keep on growing. Now, when we talk of breast cancer, the breast tissue has got fatty tissue and fibrous tissue and glandular tissue, right? So most of the tumors that come up in breast cancer, they are from the glandular or the duct, what we call as the ductal carcinoma. Now, why does cancer take place? There are several reasons. There is no one particular reason that if this happens, cancer is going to develop. The several factors include hereditary, which means if mother has breast cancer, daughter developing breast cancer becomes 3 times more common. If mother and sister have got cancer of the breast, the person developing cancer becomes 6 times more common. And if it is mother plus auntie plus sister, it is 9 times more common. The other factors which are responsible are environmental. Some dietetic factor is also there. Environmental, exposure to ultraviolet rays, very likely to develop into breast cancer. In India, that is not a very common factor. However, in India, dietetic factor is important. High fat content, salty food, right? All these lead to increased hormones. Menarche starts early, menopause is late, late marriage, late child leading to prolonged estrogen exposure are factors which lead to cancer. Right? There is also a genetic factor. There are 2 genes which are called breast cancer 1 and breast cancer 2, BRCA1 and BRCA2. If a lady has these genes in her body, the chance of developing breast cancer is high. So as you have seen, there is a dietetic factor, there is a hereditary factor, there is a genetic factor. Now we can't prevent all these, but what we can do is early detection. And that is why it is important that ladies beyond the age of 40 should keep on doing self-examination of the breast. Because nature has given the breast tissue outside the body, it is easily palpable. So every lady while having bath, at least once in a month, should palpate the breasts. Your doctor will show you how to do the breast examination, or it is given easily on the internet. Now if you do breast examination, you will be able to pick up breast cancer in the early stages, right? If cancer of the breast especially is detected early, the cure rate is quite high. So there are 4 stages of cancer, 1, 2, 3 and 4. The 2 and 3 are again divided into A and B. So 1, 2A, 2B, 3, A, B and 4. 4 means already the cancer has spread everywhere and there's hardly anything that we can do. Stage 1 is too early and even self-examination of the breast may not be able to pick up. But 2 and 3 are the stages where we can do an examination of the breast, after that clinical examination by the doctor, early detection and its treatment. Most of the cases respond to surgery in the early cases because we can remove the tumor mass and then probably give chemotherapy or radiotherapy also as adjuvant therapies. Once the patient moves into stage 3B or 4, there's hardly anything we can do. And therefore, it is very important that we all be aware that self-examination of the breast and clinical examination is going to help us. Once you know that there is a lump in the breast which is rapidly growing, which is painless, or there are swelling in the axilla, that is the armpit, the first test that we do is a fine needle aspiration cytology. If that does not show anything, then we go for an excision biopsy. And in the olden days, we used to do a radical mastectomy, that is removal of the breast and the muscles, etc. Nowadays, we don't do that. we do a simple mastectomy, we reconstruct the breast, so it is minimal invasive, and the muscles that are behind the breast tissue are used to reconstruct the breast. So I will not go into the details of the treatment. This much is sufficient for us at this stage. Focus on early detection. Leave the rest to your doctor. Thank you very much.